Hi everyone, this is Dr. Pavana, Psychiatrist from Akshaya Medical Center, Vidyaranyapura. Before knowing what is persistent depressive disorder, we need to understand what is sadness. Sadness is nothing but an emotion where everyone would feel at some point of their life. But when this sadness is continuous, unable to manage with their life, impacting their every day-to-day life, and along with that they have symptoms like in lack of interest or hopelessness and helplessness, that is where we give it a terminology of depression. Now coming back to what is persistent depressive disorder, it is something like which is also called as a dysthymia, where there is something called as an emptiness in their life. Now coming back to what are the symptoms for this persistent depressive disorders or how do the patients present with is the sadness, as I already mentioned, would be continuous, unable to manage with their life. There is a sense of emptiness or in hollowness, that is whatever they do is not enough. They're not happy basically in life or impacting their every day-to-day life. Maybe it is pertaining to their personal life or a job, decrease in self-esteem, hopelessness, having a pessimistic attitude towards life. Whatever said and done, they cannot take things in an optimistic way. These are all the symptoms of persistent depressive disorders. Now, what causes persistent depressive disorders or dysthymia is there are a lot of causes to it. One could be a biological cause where there is a change in the neurotransmitters, that is serotonin. There are basically very much of chemicals which are present in our brain where there is an imbalance to it. Most commonly it's a serotonin or dopamine, or these are all the chemicals. Then there could be a genetic predisposition or lifestyle changes or environmental changes, or people who are gone through too much of an adverse life events also are much more prone to having a dysthymia or persistent depressive disorders. Now coming back to, does everyone feel this way, or persistent depressive disorder could be common to everyone? Does everyone go through all these things? Not really. As we say, in any disease or any disorders, there could be risk factors to it, like having first degree relatives who are already suffering from a mental health illness, or there might be a lot of people who have gone through a lot of adverse traumatizing life events or childhood trauma, and there might be a number of causes to it where they have a poor coping mechanisms or an unhealthy way of managing their problems. They are much more prone for having a dysthymia or depressive disorder. Now, how to overcome this? How do we manage it? That is, take steps to control over life. I mean to say, increase your resilience, boost your self-esteem, have an hobbies, or have a healthy lifestyle in your living. React if you are having any issues. Reach out to your family and friends in your crisis time, or if impacting on your quality of life, then I think taking professional help would be much more helpful. It makes a lot of difference because after all it is impairing your quality of life, your job, your personal life, everything. I think if needs to be fixed, I think it is much needed of professional help. Thank you.